Hi friends, thank you so much for joining me today. It's so great to have you here. So my name is Joyce and I am a physician associate and I am the face behind this channel. In this channel we talk all things health, we encourage one another, and I also give you some insights on being a physician associate in the UK working in general practice. So if you are someone who maybe has a specific condition and you'd like to know more about the condition, then please stay with me and then we can go through that with you. And also I'm quite happy to discuss any specific conditions that you might want more information on this channel. Just drop a comment below and then I can discuss that with you. So I'm actually starting a new series and this is going to be basically a gastro series. So I'm going to talk all things tummy related, alright? So I'm going to do a few weeks of me discussing certain conditions which have to do with your tummy. So today I'm going to actually talk to you guys about acid reflux. So I thought let's start with a very common one that some people have suffered through at some point or another, so that we can know a bit more information about it and also know how we can manage the symptoms. All right, so if that's something that you are interested in, or you know someone who has problems with acid reflux, then stay with me and then we'll talk through that with you. What is acid reflux? It's also called gastroesophageal reflux disease. So that's the long word, but we'll just refer to it as acid reflux. So what is it? So it's when acid flows back up from the tummy or onto your esophagus, which then causes irritation and in sometimes also causes inflammation. So what are the symptoms of acid reflux? So you can have you can actually feel as though whatever food you've eaten is actually coming back up. You can feel indigestion, you can feel a heartburn, you can also feel quite nauseous with this condition. The other thing is you can have a cough with it as well. If you can imagine, if food is coming up, it can cause you to cough as well. You might also find that your voice might be a bit more hoarse than what it normally would be. And you can also, some people would describe it as though they have like a burning chest pain. So those are the sort of symptoms that people would present with who have acid reflux. So I'm going to now go on to the risk factors. So what puts you at risk of having acid reflux? One thing is if you have a hiatus hernia, that puts you at risk of acid reflux. Because of the location of that hernia, you then can have this indigestion or the feeling as though food is coming up the esophagus, causing you that irritation and the coughing. The other thing is if you are obese or if you are pregnant, again, so even if you might not have had acid reflux prior to your pregnancy, you might find that you would have acid reflux during pregnancy, during that time, because it's to do with, obviously you are growing your child in your womb and all things are being pushed up. So that's the reason for those symptoms during pregnancy. You might have symptoms if you are someone who eats spicy food, that would trigger acid reflux symptoms. And also alcohol is another risk factor for that condition. So when you present to your clinician in general practice with heartburn, acid reflux symptoms, sometimes you can even be burping as well, what they will do is they will ask you obviously your symptoms, and then in terms of investigations, what they will do is, or what would help them to work out if you are having this condition, is doing they could do a breath test But for us in our general practice in the UK, we tend to do a stool test instead for H. pylori. The other thing is, the other way also to give a diagnosis of the condition would be if you have endoscopy. So they would put a camera down your throat and find out exactly what's going on in there, because the camera would actually show exactly what's going on along the lining of the esophagus all the way down there. In terms of management, the key thing with acid reflux is antacids. Sometimes, depending on your symptoms, if your symptoms are quite mild, you might be able to get away with managing with just the over-the-counter antacids, because sometimes you only get that like with spicy food or certain foods and drinks that you've drunk. So if you avoid those, you might find that you don't have symptoms, or you have less of the symptoms. The other thing is proton pump inhibitor in the form of omeprazole or lansoprazole. With omeprazole, you can actually get that over the counter. It's called 𝚘𝚘𝚕𝚔 over the counter, so you can get that over the counter in some cases or in some countries. The other thing, if maybe your trigger is obesity, so obviously definitely trying to lose weight or making strides to losing weight would help with symptom relief. And with pregnancy, you'd find that if you didn't have the condition prior to pregnancy, once you've given birth, you wouldn't have the condition afterwards for the most part. So it would be more of a temporary reaction to obviously the body changes that are going on while you're pregnant. The other thing that you can do is also to look into stopping smoking, because that would also help with your acid reflux symptoms, if that's linked to why you're having those symptoms. So in terms of monitoring, so assuming you've had the stool test and it's come back positive, you would be prescribed some medication, and you might be also, the GP would recommend possibly a camera test just to make sure that there's nothing else going on. So you would manage with that, because the thing is, we don't want you to be on the PPIs or the omeprazole for an extended period of time. So we would want to know exactly what's causing your symptoms. So I do hope this video has been helpful for anyone out there who's been having like indigestion, heartburn, and not knowing exactly what is going on. The thing that you can start already doing is to do like a food diary and see what, if any of the foods you're eating are actually triggering the symptoms. In most cases, some people would say sugary stuff trigger their symptoms, and some people would say that spicy foods trigger their symptoms. So you need to just work out what's triggering your symptoms and obviously avoid the triggers as well. All right, so but if you are having acid reflux and you're actually bringing up blood, that is a red flag sign, and that's something that your clinician needs to look at. So you would need to go to your doctor, your physician associate, or whoever the case may be, and get that looked into a bit further. So I do hope this has been helpful, guys. If it has, please do comment down below. If you have had acid reflux and are going through this, please share your experiences as well, because I'm sure that there would be someone out there who would benefit from, you know, your experiences. So let's share, and definitely let's like this video, share with others, and don't forget to subscribe. All right, so take care, and I'll see you on my next video. Take care. Bye bye.